So I feel like I should start making a disclaimer statement at the beginning, like all of this is subject to change, like in the next minute. So what I tell you now might not be the case in a little bit as we get new information or um, get a smaller allocation of vaccine than we anticipated, which was the case this week. So we're constantly changing what we say and do, but this is the most up-to-date information as of 2:37 p.m. So that Texas did receive 401,750 first dose COVID vaccines through the state. Again, most of them were administered through the 85 hubs that they've got set up. Here at Public Health, we got 975 doses, which we thought that we were getting the 2925. But as with everything, it's subject to change. It just depends on what drops in our allocation system. We request many more doses than what we get. Staff gets in there every week and makes requests for, lots of doses. Last entry was a request for 5,000 doses. We've requested 3,000 doses. But of course, it's all subject to what they have available across the state. The minimum allocation we had been told would be 2925. It did not pan out this week. We should know on Thursday what we have for next week. Again, hoping it's at least the 2925. But this 975 for this week we should be able to get an additional almost 200 doses from that. So I assume that we will be able to actually administer somewhere in the neighborhood of 1,150 to 1,170 doses out of that. Most of our staff can get the 6th dose out of each of those vials. They say that they come with 5, but most vials are giving the 6th dose. We do have all slots for tomorrow's hub filled, so that hub event is completely booked. We did a walk-up line last week, which really kind of serves two purposes for us. What we were finding was that as we had no-shows at all the different hubs we were hosting, we would have no-shows, and so there would be extra doses at the end of the day, in which we would have to scramble to try to quickly call people to come in, right away for a dose. So having this walk-up line can serve as that purpose. After people are an hour late for their appointment, we put them into the no-show line or a no-show tab, and we count our no-show doses. And so we will start administering those once we know we'll give that dose away to somebody else. We can pull people from that line, the walk-up line. But really the main purpose is to allow people an additional way to sign up for a vaccine. And so if they show up at the walk-in line, they will be scheduled for a future hub event. The hours for the walk-up line, we are not going to open those doors until 9 o'clock. That gives us time over in the scheduled line to get the flow going, to get those people in the door to start that process. And then we can kind of focus over in on getting that other line opened up where we funnel people through and we start scheduling appointments for future hubs. They will leave with an actual appointment. Now, even if they've already signed up on the wait list, and they just haven't received their call, they are welcome to come to that scheduling line. I would discourage people who are not very mobile. If you have trouble with mobility, this is probably not the best way to get an appointment. We are now taking calls at the health department to schedule for future hubs. So if they call here, they can get an appointment. We will continue to work off of the wait list. So if people signed up on the wait list, we have staff that will continue to work off of that list. But as I've mentioned to you several times, it's a very inefficient way to get the schedule filled, because we could make up to 700 calls and only fill 300 slots, rather than just allocating people to answer calls that are coming in live and going ahead and scheduling people for appointments. The problem with that is what happened this week is you think you're going to get an allocation for the next week. You go ahead and you fill those days with all those appointments, and then your allocation changes and you've got to go back and undo what you just spent all that time doing. So it's very frustrating. We are asking people to please be patient. It is frustrating, I know, on your end, but think about the staff who is having to go back and recall all of those people that they had scheduled for Tuesday, or first we scheduled it on Tuesday, and then we said the state said they weren't going to ship the vaccine until Monday or Tuesday. So we moved everybody to Thursday, and then it was going to be bad weather. And so they're like, no, let's not do it on Thursday, because we don't want a lot of the elderly people out and potentially slipping and falling. And, that could be very hazardous. And so we moved it to Wednesday. So yes, it's frustrating, but I guarantee it's even more frustrating for the staff that's having to do that. We did repurpose 14 of our contact tracers to scheduling. And so I've got an additional 14 people answering phones. That means that we've got up to 25 people who are just scheduling appointments. So if people call and they can't get through right away, be patient. You can try back later. You can keep trying. We will continue to funnel all those calls through everybody who's available, but it just may take a little bit of time. Again, it's fine for people who have previously enrolled on the wait list to go ahead and call if they want to go ahead and schedule an appointment. But those people that maybe don't get the message that there's another way to get an appointment, we'll continue to work off of that wait list. It is just very inefficient. So you have to keep in mind that we've got 25,000 people, I think, on the wait list at this point, or pretty close to 25,000. And we've only received, I think, a little less than 6,000 vaccines. So it is very slow going. We have people call every single day, all the time. People come up here. I signed up 3 weeks ago or a month ago, and I haven't received a call. I know we're still calling people who registered like the 1st, 2nd, 3rd, and 4th of January. And so that's how slow going it is. So they could potentially get a vaccine that day if we're trying to get rid of it, and we need an arm to put it in, and we've got a willing participant that is there. They could potentially, but it would pretty much be like winning the lottery. It's not a huge chance, but that is a good way for us to be able to go ahead and administer that dose without having to scramble to try to call additional people to get them to come for that dose. So yes, but I would not show up to the line anticipating that you would get a vaccine, because it's more likely that you will not. I've heard different things. The truth is, I'm not really sure. I don't want to speculate what's going on at the state, because I really have no idea. I know they also have a very difficult job in juggling and managing all of that. So I don't want to, present them in a negative light. What are we doing? I think everybody is doing everything that they can. We have our elected officials. We've got our city leadership, county leadership, writing letters to senators, representatives, trying to get meetings with people high up at DSHS. Everyone is advocating for that. I know Hendrick has advocated for refiguring the formula and how those doses are allocated to each particular jurisdiction. It's based on a formula and it's based on percentage of your county population. And so I think that everybody is doing everything they can, but I also have a direct contact with the person who's actually allocating all the doses to the hubs, and they're limited by what they get from the CDC, and it can only go so far. And so they're having to make those very tough decisions. They want to get everyone vaccinated as well. So I think it just boils down to they've got a formula in place, and I don't think they have any intentions of changing the formula right now, especially as they continue to wait for additional guidance from the new administration at the federal level. They had said that they weren't going to change anything about the formula and how things were being allocated and distributed out to the states. And so they've held firm in that they're kind of maintaining status quo until they get further direction. The only new piece of information that they passed on to us as far as who they wanted us to target was that they were really hoping to target those who were 75 years and older. So we want to try to prioritize those people. But again, it requires those who have 75 and older people. If you yourself are 75 and older, or you have a loved one that's 75 and older, call the health department, try to get on the list, on the schedule. Right now, the only thing that we're scheduling for, if they walk up tomorrow at tomorrow's event, we're going to schedule them for February 28th. Because we do not know yet what our allocation is for next week. We have not scheduled, we're not scheduling. We want to give a little bit of time and schedule out for the following week. But as soon as we know, we'll start scheduling for this next week as well. Yeah, and you've seen the numbers continue to drop, which we find very encouraging. And so as public health, we're shifting our focus really to get all hands on deck to try to get people vaccinated, to get them scheduled and try to streamline that. We feel like that is more the need right now to make sure we're responding appropriately as the community needs us. And so with the cases dropping, with case investigations, with those contact tracers, I think at this point we've kind of figured out, we know where cases are coming from. We've got that down. We've gathered the data. And so I think it's more imperative that we switch to vaccine response. And so these people will also be helping at the hubs to make sure that that is an efficient process. So yeah, we had at one point, I think 20 contact tracers on staff. And so we've transitioned 14 of them over to help with this. Oh yeah, we know that they're getting on multiple waiting lists. We know we have people from other jurisdictions signing up on ours, but that is what you agree to when you sign up as a hub. You cannot limit. We've got people driving in from Houston to come to our hub. But we've had people from here in Abilene go to Dallas, to Midland, to other places because they can get, they've done the same thing. They've gotten on multiple waiting lists. They're willing to take a trip somewhere else. And so as we make those calls off of the waiting list, staff has reported that, they said, I've already gotten in Midland. They've driven to Dallas. Some have driven to San Antonio. I think a lot of it is they have family other places. And so these are the ones I'll try to get on theirs as well. And it's just whoever calls first. So, yep, that's part of what makes it inefficient is you're calling people that already got it. So you leave a message, they never call you back. And then some, it's older people a lot of times don't have a voicemail set up. They don't get to their phone on time. And so, we've heard that as well. Like, well, my 90-year-old mother doesn't have voicemail and she can't get to her phone right away. And I'm like, well, I don't know how to fix that. Give us a different number and we can try calling maybe you instead of your 90-year-old mother, and you can set up the appointment for her. So we've tried to help people troubleshoot like that because I can't some of the problems we can't fix. Yeah, we haven't gotten as many reports from long-term care facilities. I'm not sure if it's up. I think it's up. We have a really new cool death data dashboard that we've added to our website. And so it actually is, you can click at the top and like remove long-term care facilities or remove a certain zip code or whatever and kind of play with that death data, which is kind of an interesting little tool. If it's available yet, I know he sent it to me. And I think that the plan was to get that up. I'm just not sure if it's up, but anyway, it's an interesting little tool to use to look at the death data. But yes, it has dropped in long-term care facilities here locally.